Let me take a step back to Obamacare and the recent things in legislation for a moment. How does policy like Obamacare and Trump's recent there were some recent things done in the big beautiful bill with healthcare.
Mhm.
Were you in when Obamacare came in, and did you see a difference in how healthcare coverage affected providers and patients alike? And then, so we were talking what 2008 ish, and now recently we've had some changes. Talk to me a little bit about the political policies going on in healthcare and what people should know about that.
Yeah, I mean, I think there was a lot of good intent with Obamacare. I think it caused more confusion. The intent was to lower cost of healthcare, and unfortunately, it did the complete opposite. I think that's what has increased rate increases from every single angle, either being the provider increasing their rates, the health plan increasing their rates, the insurance carriers, whatever the broker's fees, the solutions of another solution, because there's so many different, you know, products and solutions that pop up over years. And I'm like, how did this become a solution? Like we're already covering 80% of this problem, and now you're just basically banking on the 20% that could probably be modified in this other solution. So I think that it's created a lot of scare. The one good thing I think that it, of course, did do was eliminate pre-existing conditions.
Yeah.
That was a very cruel and unnecessary thing that they were able to bank on from somebody that, again, it wasn't just a lifestyle choice of maybe why they became, with a pre-existing condition. This could have been genetics. This could have just been something that they could have never, avoided. And so that was, I think, a great product because there was discount health cards that acted like insurance, and it brought no value. And yet people were walking in there with their discount card thinking like, hey, I got insurance. We're like, no, you don't, well, we'll give you some meds, that's about it. And so I think that the intent of it was good. There was too much stuff that I think was thrown in there that really later down the line, a lot of people knew were going to be problems. And now that's what we're dealing with. As for what Trump's doing, I think it's great when it comes to the pharma side, because I've been saying this kind of like how I was in my, Nostradamus phase of where I felt we should start another network. Is the PBM world, pharmacy benefit manager world, is a mess, and it's been a mess. And I'm happy that Mark Cuban and other really smart people and successful people are trying to tackle that, not gain some more friends in the pharmacy benefit manager world, but I really could care less, is those people are the reason why costs are so high on pharma. And I'm so happy that, again, like Trump, don't like Trump, put politics aside, he is driving down the cost of pharmaceuticals.
Are we seeing that yet? I know that he's going to providers in other countries that either source our drugs or buy our drugs and saying, hey, if it's lower here, if it's $1 here and it's $10 to us, it needs to be 99 cents to us for $1. It needs to match the lowest cost of this drug that you're selling across the planet.
I think those savings have not been truly seen or identified quite yet. I think that is coming. But what it has done, it has put heat and pressure on the companies I mentioned that have been abusing the system and jacking up prices. So I think now those folks are seeing, okay, we probably should get our act together. We should probably do this a little bit better. And we should find ways that we can still be profitable without completely jacking up the price of this PBM management system or being able to lower these drugs, because again, it's pretty outrageous. And especially, we have the luxury of living here in San Diego where, we could go down to Tijuana and get some meds for much cheaper, or people on the northern part of the country that can possibly go to Canada. But if you're living in St. Louis or Oklahoma or, middle of the country, you don't have that luxury, and of course, a lot of people don't really know how to educate themselves on where they should be getting their meds from. And it falls still on the broker, falls still on the health plan. And, again, when you have PBMs, though, that are giving a nice premium back to the plan, not the employer, but to the plan manager, why am I going to try and change when this is a great revenue stream back to me as well?
Yeah, and I mean, I like you said, like Trump, like him or hate him. I mean, to do this, he's probably pissing off some of these pharma companies.
Yes.
It doesn't do him any good to lower the prices, lower their profits. I would think it's a win for him, for the American people, and all parties involved in this.
It is. And unfortunately, as we know, regardless if it's red politicians, blue politicians, they all are smart business people and they all are profiting from the healthcare industry. So it's good to see that it's probably disrupting both sides. And and that's where I think, again, it's easy to criticize him, but there's a lot of good that he's doing. And I think that the healthcare industry needs this. Now, if it's fully implemented, we'll see. But I think the intent is there.
Continue on that topic. Trump has talked about reforming the healthcare system. I know in his first term he tried to reform it, and he couldn't figure out a solution. He's talking about some new solutions now. Do you think in his term we will see a new structure to our healthcare system?
I hope so. I think that the biggest thing that we would need is removing some of these merged companies like United, who owns now the pharmacy. They own the provider. They own the clearinghouse and the payment claim system as well. And when I won't say into specifics, because again, some of these people, are potential or existing clients, but when you have such consolidation, you remove the real true intent of what the insurance carrier's job is to do. And so that's where I see Elizabeth Warren and I see, Mark Cuban trying to put together bills that would remove those assets from these insurance carriers. And I would think if anything can be done, that would be the biggest accomplishment. I know there's a lot of other things that we're trying to do and in the pharmacy space, but I think that would be the greatest thing for the American people if that was removed and you put insurance carriers back to being actual insurance carriers, not the medical provider, not the pharmacy.
I mean, it's a monopoly. It is truly what the founding fathers were like, hey, no monopolies, because it drives cost up. It silos people into whatever, path they want to take them in their organization.
Yeah.
They can just charge whatever they want to charge. And
it's ridiculous. No, it's ridiculous.
Let me switch gears here. Let's talk a minute about wellness versus healthcare. And I don't know how much you know about this, but in insurance plans and when you're seeing providers, is wellness being talked about as a means to help prevent diseases when there's wellness tactics that are proven to prevent some of these diseases before you have to go in and get surgery or you have this terminal illness now? Like, what does the wellness landscape look like versus fixing the problem when it's already, in the person?
Yeah, I mean, I think that wellness solutions and wellness providers are emerging. We have put a strong emphasis on wellness and mental health. There is so many things that can be prevented that lead to a larger medical bill or a catastrophic claim that could be prevented in simple wellness or mental health treatment. And I think when you're not truly incentivized by big claims and negotiating those down and getting paid large amounts to try and hopefully have an overpriced bill that you're then bringing that price down, it removes that incentive. And so we put a big emphasis on direct primary care. We put a big emphasis on collaborative care. What we're trying to do is keep the member central to certain providers so that they're not bouncing around town and getting all these different bills and outside of an ecosystem that can be controlled in one cost. So what we try to do is educate the members on certain care that is much cheaper, but now is preventing a much larger issue for the member.
Wow.
And again, it's sometimes some people, you got older folks that no matter what, I got to go to my hospital. I want to go to my hospital. And it's like, you don't. You're going to get maybe more sick going to this hospital. I'm sorry, and taking some of these procedures or treatments out in a much more controlled direct primary care model. But unfortunately, some of these networks, because they can't make a lot of money on that, why am I going to push actual real care?
Yeah. Wow. Isn't that is something. I'm looking at healthcare insurance in America. Like, we're all in a pool together, similar to the car insurance companies. When there's a ton of claims, when the fires happen, the natural disasters happen, we see our insurance for our car go up. Is it similar in the healthcare industry?
Yes, but to be honest with you, I don't know how prices are keep rising, and that's where it becomes greed. And that's where It becomes, let's just apply a certain methodology. Let's also, now that I am in the insurance carrier and I'm the medical provider and I'm the pharmacy, well, I'm going to tell these two entities to start overcharging. So then it can justify my rate premium increases because they're supposed to spend a certain amount of their profit back into the plan or give back to the stakeholders.